In Germany, they're drafting in the army, soldiers readying to replace civil servants who may get overwhelmed. With 22% of its population over the age of 60, Germany may soon see the death rate rapidly rise.
We're all aware that the fight against coronavirus is a marathon. In the end, it will come down to being able to provide and maintain resources. That'll be a task for the German army in particular.
Enthusiastically, if not necessarily tunefully, residents in one Bavarian town sang Ciao Bella in solidarity with Italy, the unwitting leader in a race no one wants to win. In Italy itself, the radio plays the national anthem at 11 every morning, a patriotic boost that people needed today after the death rate in Lombardy was reported to have risen by 380, the highest so far in a single day. In France, they don't kiss on Main Street anymore, they disinfect it. Paris residents have retreated to their homes as ordered by the government.
We are at the start of this crisis, as I reminded the French people at the beginning of this week. We put in place measures to absorb this first wave. It's a race against the virus. But we're only at the beginning, and we need to continue to be reactive.
The French have world-class hospitals, highly trained and motivated medical staff and the best equipment. And yet, like the Italians, they'll struggle if, as expected, they're overwhelmed with patients. So what then will it be like if COVID-19 sweeps through a camp of Syrian refugees in Lebanon, where it's hard just to keep the kids clean in normal times? Each family has been given an extra bar of soap and what they call awareness training.
We need protection. Our situation is bad. We don't have houses to stay in. We have nylon sheets, and nylon carries germs by itself. We don't have walls or anything. We don't have face masks for protection. We don't have soap or sanitizers. Whoever breathes, his neighbour could feel it.
They're trying to teach people about the disease in Idlib, where millions of Syrians have been displaced. Hard to see how they'll manage when the hospitals have been bombed and everyone's on the move. They're disinfecting the school tent while the children look on. Witnesses to a new catastrophe that's sweeping not just Syria, but Europe and beyond.
Lindsay Hilson there. Well, joining me now from northwestern Germany is Peter Liese, an MEP and a former GP. Peter Liese, thanks for coming on our programme. Can we just start off by clarifying some figures? Is it true that Germany has almost 20,000 cases of coronavirus, but only 66 deaths?
Yeah, I will just double check the figures on my other device, but I think that it's true. Yeah, I have it here.
Yeah.
Because I have almost 20,000 cases, 53 fatalities, compared to 9,300 cases and 167 fatalities, for example, in the UK. So let me say first that we are all in this together. And I think cooperation in science, cooperation in exchange of good practice is more important than ever. And I think it's not important that politicians are blaming each other. That's why I think we need to fight together, but also we need to learn lessons. Italy, in the moment, is worse than China. They have more fatalities than China. And in Wuhan, we have already, I think, very, very correct information. No new infections during the last 2 days.
Okay.
So this is important to learn that we don't go for the Italian way, but for the Wuhan way, how strange it may sound. So now to the figures. The German figures are quite high in infections, and they are quite low in fatalities. And I think there are 3 explanations. Nobody knows it really, but I talked to a lot of experts. And the first reason may be that, in fact, our health system is quite quite good. You just have reported the ratio of intensive care beds. That may be a point, but I think it's a minor point. Then the second point is that many of the people we tested now, and they are positive, they come from skiing areas in Austria and northern Italy. And when you go skiing, you are not severely diseased. You are not over 80, you don't have any heart problem, any lung problem, which means that we may see higher figures in Germany when the virus comes in homes for elderly or in hospitals. But the most important point is you shouldn't believe in the figures, because the figures of infected people, confirmed cases, only shows how much you test. And I'm convinced that we have tested a little bit more, definitely not enough, but we have tested more than the UK, more than Italy, and more than Spain.
Right.
So you have a higher fatality rate. It's only a statistic effect. It's just because we tested more. So we have all more infections than the official figures shows, and that shows how important containment measures are.
Right. But that's a really interesting answer. But when you compare the number of ICU beds in Britain to Germany, 6.6 per 100,000 in our country, 29.6 in your country, that is an alarming discrepancy for us.
Yes, it is, but it's not the worst, because at the moment, very few beds are used in Germany. So we are preparing for the worst. I'm preparing myself. I'm practicing to be fit for the purpose when I have to work as a general practitioner again. But we are not yet in the situation where we need all these beds. Why I'm also in favor of having solidarity with it. But the worst is that we are in an increase of the figures.
Yeah, I'm afraid we're going to have to, sorry to interrupt, Peter Liese, we're going to have to end it there, but thank you very much indeed. Krish.
Well, joining me now from his Leeds constituency is the Labour MP Alex Sobel, who's led the call for a universal basic income to be introduced during this public health emergency. How would it work?
Well, basically, everybody would get a payment every week, and then whether they were employed, whether they were self-employed, whether they were unemployed, whether they were on a 0 hours contract, and that would be enough to cover the basic necessities.
And how would you answer the simple point that not everybody needs it?
Well, I mean, we used to have child benefit, universal child benefit, nobody needed it. There'll have to be a call for people to sign up so they can be paid who aren't, for instance, on benefits now. And so if you don't feel you need it, just don't give HMRC your payment details and you won't get it.
So how much would it be, and how would it be paid for?
Well, I mean, first of all, how would it be paid for? You know, we've talked about 300 billion stimulus that the Chancellor's proposed. We're in a complete crisis situation. We need to make sure people have economic security. If we don't, then the confidence will collapse out of the system. So that is actually more important than how it be paid for. But later on, we'll find that actually the system will right itself because of the way that the money supply will work. So we're obviously going to there'll be a form of quantitative easing. We saw this in 2007 crash. That was used for banks. Instead of quantitative easing for banks, we're talking about quantitative easing for people who'll spend money in the real economy. So actually, it'll be much better than the quantitative easing we did back then for the banks.
A lot of people have been talking about this, but it does have its critics. And one of the big criticisms is once you have a lot of people who are reliant on a universal basic income to meet their basic needs, it becomes very difficult to take that away.
Well, I think we're in unprecedented times. What we're seeing is that we've designed a social safety net that has got such big holes in it that people are falling through it. 5 million self-employed, 1 million people on 0 hours contracts. And so it needs a big move to fix that. This, I think, is the big move. Later on, what we need to do is actually rebuild a much better social security system. We have to acknowledge, actually, that our social safety net has failed. And the measures that we need to fix it in a bespoke and complex way will take far too long. way longer than this crisis will probably last. So we need to make this move now and
Alex,
then look at how to fix it properly later.
Thank you very much.
Thank you.
Now, President Trump has announced an agreement between America and Mexico to close their shared border to all but essential travel. This came shortly after the New York State governor asked people to stay at home as the number of cases of COVID-19 reached more than 7,000. In California, all 40 million residents have been told to stay at home. Siobhan Kennedy is in Washington for us now. Siobhan.
Well, Matt, the president also announced today a clampdown on asylum seekers from Mexico and Latin America. Of course, thousands of them try and get across the border here each year. They are held in detention centres while they await their hearings. Well, no more. President Trump said today that because of the dangers of the virus that they might bring in, that they would be rounded up and returned, he said, back to where they belong. It was a particularly combative press conference today, Matt. The president still very much trying to play down the crisis, even though the numbers here in the US are rising exponentially, particularly in New York, as you mentioned. At one point, he talked about a new drug, which he said he had a hunch might just work well. He didn't say why or provide any evidence. And when he was asked by one of the journalists if he was giving Americans false hope, just listen to how he responded.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might, and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens.
So as you can see there, a very angry Donald Trump today. He hates the fact that this crisis is spiraling out of his control and that he is being criticised by many people for the lack of availability of medical equipment like masks and ventilators. He's hoping to turn that round on Monday when Congress is due to vote and pass his emergency economic relief bill, signalling $1 trillion of aid to individuals in the way of checks and to businesses, including those very troubled airlines. But I have to say there are those who are already saying, given the extent of this crisis, that $1 trillion will simply not be enough.
Siobhan, thanks very much. Well, President Trump has been criticised for both his dealing with the coronavirus crisis and also his labelling of it as the Chinese virus. Well, earlier I spoke to Morgan Ortagus, a spokesperson for the State Department, and started by asking her why he was using that term.
Well, because it emanated from Wuhan, I think, as you well know. And it's been important. You know, this is not about assigning blame. It's a fact that this virus emanated from China. And what's important, really, as I just mentioned, is how do we deal with global pandemics going forward? And it's important to note that the Chinese Communist Party has a special responsibility here to be fully transparent with the world and to get this right.
But we also know from scientists here and all over the world that the Chinese authorities were very quick in sharing kind of the DNA sequencing of this particular virus and sharing as much information as possible with the rest of the world as quickly as possible. They bought us time by locking down their cities, and we've squandered some of that time, haven't we?
Oh, I don't agree with that at all. Listen, I'm not going to get into a healthcare debate because I'm not a scientist, I'm not a doctor. What I do know from the State Department perspective is that we are very, very concerned about a lot of the disinformation that comes from top Chinese Communist Party officials around the world, a lot of propaganda, a lot of stuff like claiming that the United States Army is spreading this disease, or saying that that this was a bioweapon created in the United States.
But that's not Chinese government. That's not Chinese government policy.
We called in the Chinese ambassador and demarched him last Friday specifically because of this stuff. So this isn't happening from random internet bots like you often see with Russia. This is coming out of the mouths and on the Twitter pages. It's right there in black and white from Chinese Communist Party officials.
You're in a leadership position. What's America doing for the rest of the world?
The United States has committed over $100 million. I was just on with an Italian outlet right before this one. We were talking about the fact that it's not just the American government. We're certainly providing money and aid and equipment. Our embassies around the world, if you go on their social media pages, are showing pictures of them providing aid. But we also have American businesses like Eli Lilly that have provided 100 million euros of insulin to Italy. We also have Samaritan's Purse, a faith-based organization in the United States that just provided 60 beds in northern Italy where we're fighting this crisis. In the United Kingdom, we've got McDonald's and Starbucks, which are providing free drinks to healthcare workers in the UK and to people who are involved in this crisis.
One final one. President Trump today in his press conference was asked by a reporter, what he would tell the American people who are scared. And he basically bit the reporter's head off and said this is fake news. I mean, what people want to hear from the commander-in-chief is some sort of message of reassurance, not a fight about fake news.
I think he's done a fantastic job of reassuring the American people that of this war that we're in with an invisible enemy, with a deadly virus, that we are going to come together. And when we come out of this, we will be stronger than ever. And I'm certainly encouraged by that.